Hello, thanks for joining us. I'll start with the usual run-through of the daily COVID statistics. An additional 159 positive cases were confirmed yesterday. That represents 1.9% of people newly tested yesterday, and so the total number of cases now is 21,878. A full Health Board breakdown will be published on the Scottish Government website as usual later, but my provisional information is that 63 of these cases are in Greater Glasgow and Clyde, 29 are in Lothian, 19 in Lanarkshire and 10 in Forth Valley. The remaining 38 are spread across the other 7 mainland Health Board areas. And that means, again today, we have new cases being reported in all mainland Health Board areas. I also want to just give a bit of context to our recent case numbers, because sometimes it can be a bit confusing to look at case numbers on a day-to-day basis. So what we do is look at the rolling 7-day average of cases. So over the past 7 days, our average daily number of cases has been 155. 3 weeks ago, the average daily number was 52. So we have seen roughly a trebling of daily cases over that period. Our case positivity rate has also gone up from being around or below 1% quite consistently to now, in the last few days, being around or above 2%. So I hope you can see why the situation just now is a matter of concern to us and why we need to continue to work as hard as we can to keep the virus under control. Let me turn to the statistics on patients in hospital and ICU. I can confirm that 274 patients are in hospital. That is 7 more than yesterday, and 6 people are in intensive care, which is the same number as yesterday. I'm pleased to say that in the past 24 hours, no deaths were registered of patients who first tested positive in the previous 28 days. So the total number of deaths under this daily measurement is 2,499. However, National Records of Scotland has also just published its regular weekly update. And if you recall, that includes deaths of people who've been confirmed as having COVID through a test in the past 28 days, as our daily figures do, but also cases where COVID is a suspected or contributory cause of death. The latest NRS update covers the period up until Sunday, the 6th of September. That means it doesn't include the 3 deaths that I reported to you yesterday. Up to Sunday, we had recorded 2,496 deaths in our daily figures. 2 of these deaths had been registered in the 7 days up to Sunday. Today's update shows that by Sunday, the total number of registered deaths with a confirmed or presumed link to COVID was 4,231, and 2 of those deaths had been registered in the previous week. I'm pleased to be able to say today, for the first time since the start of the pandemic, that there were no COVID deaths registered in care homes at all last week. That obviously is positive news, but it is not a cause for complacency. We continue to pay very close attention and be very vigilant around the care of older people in care homes. And finally, the total number of deaths recorded last week from all causes, not just COVID, was 54 higher than the 5-year average for the same time of year. That said, it's worth remembering that that figure does fluctuate a bit from week to week. Each of the 2 COVID deaths reported last week and the 3 that were reported yesterday, and indeed every single one of those that we've reported throughout the pandemic, represent the loss of an irreplaceable individual. So again, my condolences are with everybody who has lost a loved one to this illness. I also want to thank once again today everyone who is contributing to our efforts to tackle the virus in whatever capacity you are doing that. But it is worth highlighting that today is Emergency Services Day, and so I want to take a particular moment to thank everyone who works in and volunteers in our NHS and emergency services. Their service and their willingness to respond to calls for help is appreciated at all times, but it has, of course, been especially appreciated over these past few months. Now, I'm going to close shortly, as I usually do, by focusing on our very important public health advice. But before that, I want to just touch briefly on economic matters. Today saw the publication of the Royal Bank of Scotland's latest report on the jobs market in Scotland. It found that recruitment declined last month, albeit at a slightly slower rate than in previous recent months. However, recruitment for new jobs is still declining, even after the steeper falls we saw earlier in the pandemic. In fact, the survey shows that demand for permanent staff continues to decline in every sector of the economy, apart from IT. So this report underlines again the extent of the economic crisis caused by COVID, and it demonstrates the ongoing need for exceptional support for businesses during what are, after all, exceptional times. The Scottish Government will continue to do everything we can within the powers and resources we have to provide this support. We've already provided £2.3 billion of emergency support for businesses in recent months, and last week's programme for government established a clear national mission to not just protect jobs, but create new high-quality jobs with a particular emphasis on low-carbon sectors. And of course, we also have warmly welcomed all of the UK government support programmes, not least the job retention scheme. Today's report, though, underlines the need for that job retention scheme to continue and not to end in October as currently planned. If that ends in October, which in my view would be premature, it will put many jobs at risk. And by removing an important source of economic support for businesses, it would narrow the options available to us in controlling the spread of the virus over the next few months. The bottom line here, unfortunately, is that this pandemic will not end next month, and so it stands to reason that the economic impact of the pandemic will not end next month either. So we continue to urge the UK Government to maintain support for jobs and employment for as long as that is needed, and point, of course, to examples in other countries of similar decisions having already been taken. We are, of course, trying to allow economic activity, as much of it as possible, to take place as safely as possible. And we do that because of the other harms that happen if economic activity can't take place. But if the virus runs out of control again, we will face restrictions that are in themselves deeply damaging to the economy. So the best thing we can do right now, not just for health, but also for the long-term good of the economy, is suppress COVID as far as we possibly can. It is not an exaggeration to say that Scotland is currently at a very dangerous point. So too is the UK as a whole and many other countries across the world. We can see from the level of cases in countries like Spain and France that the current increase in cases could very easily continue and also start to translate into serious illness and deaths if we are not very careful. And having rightly opened up schools, we are now about to welcome students back to colleges and universities, and that is in so many ways not just a welcome step but a necessary step for the well-being of our young people. But it is also a risky development, and that's why tomorrow's review of the lockdown regulations, which I'll set out in Parliament, is likely, based on all of the recent data, to take a very cautious approach to any further changes. In fact, we can't rule out the need to make changes to the numbers of people allowed to gather together, like those that were announced for England last night. We're carefully reviewing existing guidance and regulation, as well as considering what new steps may be necessary to keep COVID under control. Of course, the key point, which I will keep emphasising, is that all of us have a part to play in this. And I don't say that to detract in any way from the government's obligations, the principal obligation the government has to help the country tackle this crisis. Nor do I say it in any way to suggest that the increase in cases we're seeing right now is anyone's fault. It absolutely is not. We've also always known that opening up the economy and society again, which we have to try to do for obvious reasons, gives the virus more opportunity to spread. But the truth is that tackling this virus has always been, and by necessity it always will be, a collective effort. It needs government and citizens to work together, and also it needs every single one of us as citizens to recognise our responsibilities to each other. The best way of keeping the economy open, allowing life to retain some kind of normality and hopefully get more normality in the months to come, without the virus running out of control, is to ensure that all of us stick to the public health guidelines. So I would ask everybody to think carefully about that. Perhaps think about what matters most to you in your life. Is it seeing family members? Is it playing football with your friends on a Saturday morning, going to the gym, seeing other people for a drink at the weekends? all of those things in our lives that we value, we desperately want either to maintain them if we have been able to open up these opportunities recently, or where we haven't yet been able to open up to do so. But all of that is put in jeopardy if the virus continues to spread and to spread more quickly. So we all need to think about our own behaviour. I know how hard it must be to hear this after 6 months. I certainly take no pleasure in saying it after 6 months. But letting our guard down does allow the virus to spread. So if we all do the right things, we minimise the opportunity that it has. Of course, it's possible for all of us to do all the right things and still get COVID. This is an infectious virus, but it is much, much less likely that we will get it or pass it on to others if we follow all of the advice. And that means, above all, remembering and abiding by facts, the 5 rules that help all of us protect ourselves, protect our families and our communities, protect the NHS, and ultimately, of course, let's not lose sight of this, save lives. So let me end with a reminder of facts. Face coverings should always be worn in enclosed spaces. You should avoid crowded places. Clean your hands regularly. Remember to clean hard surfaces that you're touching as well. Keep to 2 metre distancing because we know that that matters to reduce the transmission opportunities of COVID, and self-isolate and book a test if you have symptoms. None of that is easy. None of it gets easier as time passes, but it remains necessary to try to keep this virus under control as we continue, we hope, to take further steps back to normal life. Thank you very much for listening today. I'm joined, of course, today by the Chief Medical Officer, and both of us now are going, as usual, to take questions from the journalists. So can I go first to Laura Alderman from STV?
Good afternoon, everyone. First Minister, Professor Linda Bald said in Holyrood today that she was concerned that support for restrictions was falling, and there could be unrest because of that. Do you share these concerns?
I've not seen Linda Ball's comments this morning. I've been engaged in other things. I don't know whether she was given evidence to a parliamentary committee. As I've said before, and I will say again, Linda Ball is somebody I do listen to very carefully. She's a renowned expert, and I would encourage everybody to heed her words and advice, because she knows what she's talking about. But I don't want to comment on particular comments that I've not had the opportunity to see. I think, though, in terms of support for restrictions falling, we've been living with this now for 6 months. It's been really tough. We've had a really strict lockdown. We were all effectively told not to leave our houses, apart from if we had to go to work. And now, although we don't have those strict measures in place, we're all being asked to live our lives in a really abnormal and, in many respects, unnatural way. And that gets harder with every week that passes. So it doesn't surprise me, I feel it myself, that just the fatigue with all of that does increase. It's also the case that we've just gone through a period over the summer, and this didn't happen by accident. We had to work really hard and make lots of sacrifices to achieve it, where we saw infection levels and numbers of people becoming ill and dying fall to very low levels. And it's good that we did that, because if we hadn't driven it that low, the situation we face now would possibly be accelerating out of control more quickly. So those two things combined, I guess, means that it's not surprising that people are just finding it harder to comply with all of this. But that, unfortunately, just makes it all the more important that I stand here and not just ask people to do the right things, but explain why it's important to do them. If it is the case that we're going out more, all of us, then we have to be more careful about the things we do while we're out. This is a virus that its only purpose is to spread so that it survives and replicates itself. So it takes every opportunity to jump from person to person and from household to household. So these basic things we talk about, they're all taken from an understanding of how a virus spreads, and then working back from that to say, here are the 5 things you need to do to stop it spreading. And so they're vital. And yeah, they're all a pain in the neck, but they're less cumbersome, I would argue, and I would put to people, less cumbersome than going back to a situation where we're all told we can't leave our houses. So unfortunately, this is a virus that is there. It's a global pandemic. It's accelerating across the world. Doing nothing is not an option. So it's what we do. If we don't want to lock ourselves down again, we all have to go through these really inconvenient but necessary things to try to keep it under control. And I'm afraid it is as simple as that, albeit it's not what any of us want to still be living with. Do you want to say anything, Gregor?
I think we're in a really precarious situation just now because after so much effort, so much good work in the early part of the year and through the summer to drive down those cases as low as possible, we now start to see them rise again. As the First Minister's already outlined, thank goodness that we did do that and that we're starting from such a low baseline just now, because there's still the opportunity for us to control and contain that rise in virus that we're seeing, but it's going to need the collective effort of everyone to do that. And my real plea to everyone is, please don't let us get back into that situation where we see these unconstrained rise in virus cases that inevitably will start to spread into other age groups and start to affect older people. And from there, we'll start to see a rise in hospital admissions again and potentially even a rise in deaths. I think that that is a likely scenario if we don't take the action collectively that we can do just now to try and make sure that these simple measures we can take on a daily basis, asking ourselves, are we complying with the guidance? Are we making sure that we're doing all that we can to limit the transmission of the virus? By doing those simple steps just now, we can save a whole lot of problems in the future.
Graham Stewart from BBC.
First Minister, just picking up on the previous point, do you have any evidence yet that people are abiding by the new restrictions? And what would be the trigger point for more drastic measures, such as those rumoured to be being considered by the UK government? There's talk today even of a possible curfew. And secondly, would you consider publishing the data on local authority cases per 100,000 every day? I think the latest figure for West and Bartonshire was something like 62 per 100,000. Some opposition politicians think that would highlight the scale of the spread.
I'm always happy to consider publishing more data. We did publish yesterday the data for the 5 local authorities under restrictions. And yeah, I think the more data people have to try and understand things, the better. I will always put a caveat on, I think I did this yesterday, around, you know, the case number per 100,000 is an important indicator. So I'm not suggesting people don't look at it and attach significance to it, but it's not the only one. We need to look at almost a basket of things. Some of the things we look at will be hard data. Other things we look at are how, you know, experts like Gregor interpret that data and analyse it and draw conclusions from it. And that's where the judgment comes in. So it's not that it's not valid to look at a number like that, but it's not the case that it's the only thing somebody should look at. I'll give you an example. You could have a number of cases per 100,000 in one local authority area that was exactly the same as the number of cases per 100,000 in another local authority area, but the reasons behind these case numbers might be completely different. So in one, the cases may be getting driven by a factory outbreak, you know, like the Cooper Angus one we saw. So although they look on the face of it to be the same, it's very contained and more easily, not easy, but it's how you contain it is different. The other one, the same number of cases per 100,000, could be, as we're seeing in Glasgow right now, much more widespread transmission. So what you have to do to contain that would be different. So it's important not to assume that two numbers that look the same on the face of it are actually driven by the same things. But yes, we will look at what more we can publish. On your first question about evidence, I'm not sure exactly what kind of evidence you're looking for here. I can't, as I'm sure everybody watching will be delighted to hear, I can't go in and check whether everybody in Glasgow is abiding by the rule now that they shouldn't have people from other households in their homes. But we do some survey work. We try to assess whether people are aware of and abiding by restrictions. I think in the main, the majority of people are. This gets more complicated. I've said this before, but back in the earlier part of the year when the advice was stay at home, that's reasonably straightforward. It's not easy, but it's reasonably easy to understand. Now it's a bit more complicated. You know, you do this when you're in one place, you do this when you're in another place. We try to simplify that as much as possible, but it is more difficult for us to get our heads round. But we continue to try to make that as accessible for people as possible. And in what circumstances do we consider having to impose more restrictions? That goes back to my earlier part of my answer. We look at data, we look at a basket of things, and we make judgments that we think are necessary to deal with a particular situation. I will set out the The outcome of the regular 3-weekly review tomorrow, I've already said this week, I think it is highly unlikely that we'll see any further easing up at the moment, given the circumstances. But obviously, as we heard for England last night, with a restriction on the number of people able to gather together, that's something we have to look at as well, and we'll make final decisions on that over the course of today, and if there are changes, I'll announce those tomorrow.
The 7-day case rates are an important factor in the considerations that we make when we're looking at all the data around this, but I just urge a little bit of caution that we don't get ourselves drawn into too mechanistic a process when we're considering all of this, because even the 7-day case rate, important though it is, because of the different sizes of our local authorities, a simple, straightforward cluster involving a couple of families in a small local authority can have quite a disproportionate impact on that 7-day case rate. So that's why it's really important that we have these incident management teams to analyse the data in detail, to look at all the detail in the round, and to make sure that we're interpreting that in the right way before we're making some far-reaching decisions in terms of how we approach each and every incident.
The case per 100,000 will also be affected to some extent by how much testing is done in each area. So if you're a local authority that hasn't done any tests on a particular day, which is not happening just now, but for argument's sake, you'll have no cases. So your case per 100,000 will be 0. If you're another local authority and you've done thousands of tests, you'll have a higher case number per 100,000, but that will not necessarily tell you what the overall infection rate is. It's a reflection of testing. So all of that just goes back to my original point. It's not unimportant because we do talk about it and we look at it. So clearly it's significant, but it's got to be seen in context. Kieran Jenkins from Channel 4. Oh, sorry, I'm being told Kieran is not joining us. Peter McMahon from ITV Border.
Thank you very much, First Minister. The announcement that made for the UK effectively for England last night means that there are again differences north and south of the border, which is important in the south of Scotland and the north of England. Now, you've suggested just now that you might potentially follow what's happened in England when you make your announcement tomorrow. Given that the virus is on the rise north and south of the border, and you've always said it doesn't respect borders, is there not a case for you just picking up the phone to Matt Hancock and saying, look, there may have been tensions in the past, could we just put those to one side and have the same rules and guidance? Because we both want the same thing, which is to stop this rise in its tracks.
Look, we'll make the decisions we think are right for Scotland. Where that can align across the UK, I have absolutely no issue with that. But I just want to sort of correct perhaps a slight misapprehension in your question there. The change announced in England last night does not lead to a different position. There was a different position already. So England's change is, and forgive me if I'm not getting every detail of England's position right here, but England overnight has said that they're going to reduce the numbers who can gather together to 6. It was 30, or it is 30 until this change comes in. That's not the current position in Scotland. Our numbers indoors are 8 people from a maximum of 3 households. So those differences were there already. So to take your question and turn it the other way, if I'd said, oh, well, whatever happens, whatever my judgment about Scotland, I just need to align with England, we'd have had a situation up until now where we were allowing 30 people to gather in a house. Right now, we only allow 8 people to gather in a house. So they have had a situation up until now that I didn't think was right, and therefore we took a different approach. So I suppose what I'm just slightly correcting here, if I can be so bold, is the suggestion that their announcement has led to a different position. There was a different position. And there, as I understand it, although I haven't seen the detail yet, the 6 that have been announced could be from 6 different households. We have a household limit, and we may or may not, depending on the decisions we take today, change these limits, but I think it is likely that we will still have, as well as an overall number limit, we would probably have a household limit as well. So these differences have been there all along, and it's important that we all take the judgments we think are right and appropriate. The other thing I would say, all of this within Scotland right now, as I said a moment ago, because it gets more complicated, it gets more potentially confusing. But I think we've all got to guard against, creating confusion where actually there needn't be any, because people are no daft. You know, and when it comes to differences, whether it's differences in international quarantine or the limits in houses between Scotland and other parts of the UK, that needn't be confusing because most people know which part of the UK they live in. You know, they know whether they live in Scotland or England, so they know to follow the rules that apply in their country. So sometimes I think we have to take some care about, are we reporting confusion that is genuine? In some cases that will be true. Or are we maybe creating a bit of confusion that needn't actually be there? And I would just urge all of us to remember that distinction. Alan Smith from Bauer.
Thank you, First Minister. You'll have seen our interview this morning with Callum O'Dwyer, a 28-year-old from Aberdeen who, before becoming ill with COVID in March, he was fit and healthy. 6 months on, he's still feeling the effects. He has brain fog, he's fatigued, he's had to move back in with his parents. He's keen to know how many others are in his position and if there is information being gathered on the number of people living with the long-term effects of COVID.
I'll hand over to the Chief Medical Officer about what the approach is to try to understand this concept of long-haul COVID and the response of the NHS. You'll have heard in recent weeks Gregor, the Health Secretary, and others talk about some of the steps the NHS is taking to try to provide support for people in those circumstances. But before I do that, just very briefly, not only have I seen the video, I've shared the video on social media this morning because I think it is a very powerful illustration of a point I've been trying to make over the last few days, and I would urge people to go to Radio Clyde's Twitter feed or mine or whoever's and watch Callum's video. As I've been saying, and many other people have been saying, if you're young and you get COVID, yes, you're at a lower risk of getting seriously ill than somebody older. But one of the points we've been trying to make is you can still pass it on to somebody who's vulnerable and older, and they are at much higher risk of becoming ill. But the point Callum's video really illustrates is the other point we've been trying to get across. This illness is not risk-free for younger people. You can get seriously ill and die even if you're young. But you also, we know, and this is where there is growing evidence, you can, if you're young, and I think from memory Callum's 29 or in that age range, you can suffer long-term health effects from COVID. So Callum's talks about fatigue, he talks about gastro problems, he talks about having to have a heart scan, and this is months after he had COVID. He's had to move back with his parents because he physically can't look after himself. So, he obviously didn't get so ill that he was at risk of dying, but months on, he's living with the effects of this illness, and he's a young guy. So don't assume this is an illness that you don't have to worry about if you're young. For those reasons, as well as the risk of passing it on to even more vulnerable people, be concerned about this illness and do everything in your power to avoid getting it.
Carl's video is a very stark reminder that we shouldn't take anything for granted about this virus, but no matter what age you are. There's a lot of interest in the clinical community as to the basis as to why we're seeing people with chronic symptoms that relate to COVID-19 infection. We know that this happens with other viruses, so COVID-19 isn't unique in that respect, and many viruses cause impacts on the body's immune system in terms of an over-response or a disproportionate response that can sometimes carry on for some time afterwards. So that's where a lot of the work is currently being focused upon to try to better understand how we deal with that both in the acute phase but also that chronic phase when people's symptoms are becoming enduring as well. We were looking at ways that we can introduce different types of rehabilitation to that, both physical, and I think the other important aspect of that is the emotional rehabilitation that some people need as well. Although these are very real physical symptoms, some people, particularly if they've had particularly traumatic experiences through ICU, need some emotional rehabilitation as well. So there's all sorts of different approaches we need to understand in terms of how we help support people who have chronic effects or impacts as a consequence of COVID-19.
Thanks. And it's probably appropriate for me to say actually a personal thank you to Callum for sharing his experience. It's not easy for anybody to share publicly an experience of ill health and go into the details of what you're dealing with. But in doing this, Callum, I think, has done a real public service and has more powerfully made the point that I've been trying to make over recent days. But he illustrates that much, much better than I ever can because it comes from his experience. So I don't know if he's watching, but if he is, thank you for doing that. Phil McDonald from Global.
Thanks, First Minister. Just got a question on testing. A mum from Helensburgh got in touch with us yesterday saying her son has been waiting more than a week to get his coronavirus test results back after one of his classmates actually tested positive. She says that she's been left in limbo because of this, and it's actually creating challenges for the family. So what's causing these sorts of delays and what's being done to address them?
That sounds like an exceptional case. I hope that is an exceptional case. I would be very keen if the family are willing to have the details of that so that we can look into that specifically. For example, I'd need to know whether that was a test through one of the testing centres or whether it was a home delivery kit. But I'd be very, not just happy, I'd be very keen to look into that and try to understand what has happened there. The turnaround time for tests, we are continuing to try to drive that down. But generally, the majority of tests, the results are delivered quickly, and also the contact tracing happens quickly. Public Health Scotland will have, I'm not sure if it's one of these reports published at midday or 2 o'clock today, but today Public Health Scotland's latest weekly report will have the statistics on Test and Protect, the time it takes, the turnaround time for tests to be not just notified, but then followed up through the contact tracing. So that sounds to me like an exceptional case where something has clearly not happened as it should be, and I would be keen to look into that. Shona Duthie from Original 106.
Thank you, First Minister. With Aberdeen Football Club getting the go-ahead at the weekend to allow 300 fans into the ground for their Scottish Premiership match, there's been a few questions about whether this is the right time, given the concerns about the rising numbers of coronavirus cases. So why does it feel appropriate that they go ahead now? And also, given these test events are taking place just 2 days before the indicative date for the reopening of stadiums, is that a pretty clear indication that we won't be seeing the return of fans on a more regular basis for some time to come?
I'm not going to preempt the announcement I will make in Parliament tomorrow, but I've said a few times, I think, this week that, you know, I've used terms like putting the brakes on, perhaps not going ahead with things we had hoped to go ahead with, given the evidence that we're seeing right now. So people can draw, I think, a direction of travel from that. But in terms of the detail, I'm duty-bound to set that out to Parliament tomorrow. And in any event, the way we take decisions in these 3 weekly reviews mean that we haven't yet finalised the decisions that we're taking on these things. On the test events, so we are thinking very carefully about all of this. We decided some weeks ago that we would, and this makes sense and is important, before having, and a few weeks ago we might have hoped that this would be sooner than it might turn out to be, to have spectators back in stadiums. We thought that it would be sensible to do some pilot events to test the protections and the public health arrangements. There was a test rugby match took place at Murrayfield a couple of weeks ago with a number of spectators in, and we have given permission for a couple of other events, football, to happen over the next few days. But clearly we are in a changing situation right now, and I think certainly in future we may be a bit more mindful about things like this while the numbers are looking like they are. And I suppose that underlines just the changeable nature of what we're dealing with. That's always been true. It's an infectious virus. We can't control it completely. We can't make it operate in the way we want it to, although by behaving in the ways we recommend, we can have an impact on it. So we have to adapt and be flexible. And I'll set out more thinking around where we are and what that means for things like this tomorrow. The final thing I would say, though, that by their very nature, these pilot events are highly regulated. So in terms of the risks, they are being put together to demonstrate that these kind of events can happen without risk. So there's a lot of regulation and guidance around them, which for any that do go ahead, I hope would give some assurance to the public. Tom Eden from PA.
Thank you, First Minister. Good afternoon. Following on really from Phil's question, with sort of warnings and concern that the UK government's testing system is struggling and could even be on the verge of collapse. Yesterday, the MP for Dulwich revealed that constituents of hers were being told to get coronavirus tests in St Andrews. Now, I don't imagine people will be popping up from South London to come and get a test in a walk-in centre here. But is there a wider concern that there's a surge of demand? There will be a surge of demand for testing here from people from England. Can the system cope? And would you consider intervening to make sure testing in Scotland is prioritised for people here?
So in answering this question as fully as I can, I want to be frank, but I don't want anybody to kind of interpret what I'm saying. I've referred to this a few times in recent days already, and just by way of explanation, first of all, we have two strands of testing. We've got an NHS Scotland sort of testing strand, and I'll leave that to one side right now, and that's, testing of NHS staff, for example, routinely, or patients rather, going into hospitals. Most of the testing we do is through a sort of networked UK system. So it's part of the same UK-wide system, the Glasgow Lighthouse Lab. There are similar labs in parts of England, and they all work as part of a network. So I do have a concern, and this is a bit I don't want to be over-interpreted. I do have a concern that the way that system works, if there is a surge of demand in England, it could then lead to constraints on capacity in Scotland. And these are conversations we are having with the UK government to try to mitigate against that. So it would not be right to say I have no concerns about that, but hopefully these are concerns that we can resolve. There are also efforts underway in the UK system, as well as separately from the Scottish Government through the NHS part of testing, to continue to ramp up our capacity as much as possible. And remember, that means capacity for swabs to be taken, but also laboratory capacity. These are two separate strands of capacity that both are really important. So we continue to raise these issues with the UK government. One particular issue that was an issue in Scotland as schools went back and now seems to be more of an issue in England is somebody who is trying to book a test is being referred to a testing centre a long, long way away. And, I've heard examples like the one you cited in the last couple of days of people in the south of England being referred to St Andrews, I think, for a test. Clearly, that is not an appropriate way for the system to work. So we've been talking to the UK government about how the system can be modified to make sure that doesn't happen, that somebody in Scotland is not getting referred to a testing centre in England, for example. And Matt Hancock spoke earlier in the week about making sure, I think he was talking in an English context, that the people wouldn't be referred any more than 75 miles, which in my view is still too far. So these are issues with this UK-wide network system that we are working with the UK government to try to address and resolve, and hopefully that will prove to be successful. But we know we're going into a period where demand for testing is going to increase. That has always been the expectation as we go into winter. We saw a very high demand, particularly for tests for children as schools went back. I think that has tailed off again as perhaps understandable anxiety has receded a little bit, but we have to continue to make sure that we build the resilience and the capacity of the testing system, both as the Scottish Government and in partnership with the UK Government. Conor Matchett from the Scotsman.
Thank you, First Minister. Two questions, if I may. The first one for the Chief Medical Officer. Chief Medical Officer, I'm just wondering if you regret the speed at which Scotland opened up its economy and opened up on its restrictions. And First Minister, if I may, you've spoken a lot over the last few weeks and months about the furlough scheme and the lack of an extension. Given there's no clear movement from the UK government to row back on the fact that they're going to close it off, what's the alternative plan from the Scottish Government if there is one?
I'll hand over to Chief Medical Officer in a second. Other than to say, he'll answer for himself, but, these decisions about the speed and the order in which we come out of lockdown are really difficult. We agonise over them. We can't keep the economy in lockdown forever because the economic impacts of that are huge and they feed into health and well-being impacts. So this is not and never has been a case of we just, sort of do everything in one way and ignore the harms that are being caused in other ways. We have to strike a balance. In response to your question, to me, this is the heart of the matter, Conor. I don't have an alternative to furlough. I don't have the wherewithal to put in place an alternative to furlough because I don't have access to the borrowing powers that is currently funding the furlough scheme. The UK government is borrowing money to fund it, rightly so in my view, and if they decide to cut it off, I don't then have the ability to borrow that money for Scotland and continue it for Scotland. And the Scottish Government's budget, largely, some flexibility around the edges of this, but largely is finite. So if I was to, from within the existing Scottish Government budget, find an alternative to the UK's furlough scheme, I'd have to take that money from, the health service, the education system. And that's the fundamental point. That's why I'm so anxious about this. Now, if the UK government doesn't want to extend furlough, then my appeal to it would be give extra borrowing powers to the Scottish Government so that I can then make the choice of having a Scottish scheme. What is not, in my view, acceptable is just to leave us with no options around this. Now, I hope the UK Government will see sense on this, because my political differences with the UK Government are well known, but I do not believe that they're simply going to stand back and watch the potential tsunami of redundancies that are avoidable if they take sensible decisions. I heard the CBI UK-wide in the last few days calling for an alternative to the furlough scheme, so I am hopeful that we will get to a good position on this and will continue to press it. Sorry, Gregor.
Yeah, what I would say to you in answer to your question is all the way along, clinical and scientific advisors have been involved very, very closely with that decision-making process as to how you begin to pick your way through the difficulty of reopening a society in a way that's safe, so you balance the harm from a number of different places. Because we should be very, very clear that the harm to society is not just from COVID-19, but there's potential harm both from the society impacts, the broader health impacts, but also the economic impacts of all that has happened over the last 6 months. And that's why that blended advice is so important, so that ministers are able to make decisions that are informed by the risks associated with all of those different areas. And I think that we've been very cautious in the way that we have opened up society in Scotland, and that we have picked our way through that very, very carefully to make sure that at each step of the way that we're not opening up too much too quickly that could see a deluge of cases. And what we're seeing just now is a rise in cases just now, but that our test and protect system is responding to and dealing with. One of the things that we have concentrated on over the last 6 months is making sure that some of those mitigations to reduce those risks are in place so that we can begin to open up society again. Because believe me, even from a health point of view, I know that it's not an option for us to continue to be completely shut down as a nation for the foreseeable future. Because if we do that, the economic impacts soon start to have huge public health impacts as well, even just from the point of view of people not being able to work, to earn, to be able to live their lives in a way that is beneficial for them.
Thanks. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I just wanted to ask about the coronavirus infection rate figures that were published yesterday. Basically, they seem to show that the infection rates have more or less doubled over the past week in the 3 areas where you announced restrictions last week. I just wondered whether that indicates whether the restrictions are working or not. Secondly, I just wanted to ask, what would you say to somebody who's quarantining on return from Greece for 2 weeks, given that people can obviously travel freely to Western Bartonshire, where the infection rate is higher than in Greece currently?
Well, what I'd say to the person returning from Greece, it doesn't help us if you bring an additional infection into the country, even if it is already higher than in other parts of the country. So this is all about a range of measures to keep infection rates down. And we know importation. And don't underestimate the factor that importation of the virus from people returning to Scotland might have had in, not in whole, but in part, in what we are seeing in some parts of the country. We know from our own test and protect data that there were a significant number of our positive cases in recent weeks reporting recent travel to Greece, which is why we took the decision on quarantine. So this is not about, if we ever take a view here that says, oh, well, it's already high, so we might as well just let more infection sort of run riot and contribute to that, then it all will be lost. I mean, that's just not a sensible way of looking at this. On your question about does the increase in cases week on week show that the restrictions are not working, Gregor will give you an answer to this based on his expertise, but my answer would be no, it doesn't show that, for the reasons that we've ad nauseum talked about, that the incubation period and the life cycle of this virus means it takes probably 3 to 4 weeks to really understand whether particular restrictions are working. So the infections that we saw coming through Test and Protect in Glasgow in the last 7 days will be people that were infected perhaps 14 days before that, so possibly before the restrictions came in place. So unfortunately, it takes a bit longer to be able to know whether restrictions are working or not.
Yeah, because of the incubation cycle of the virus, it's far too early to be able to tell whether the restrictions that are currently in place are having an impact. But of course, we're charting different parameters in relation to that. So one of the parameters that the incident management team constantly looks at is, and will be charting, is the number of contacts, for instance, that each one of those positive cases has, to see whether we're starting to see a reduction in those contacts over time as well. Again, too early to see that firmly coming through, but it's some of the evidence that we'll be looking for that the restrictions are having their intended effect in that way. I just want to pick up on your point as well in terms of the foreign travel. I think it's really important that people understand why it's so important, if they're coming back from one of these areas where there is a high incidence of infection, that they're taking the approach and complying with the quarantine ask that is made of them. If you look at the Scottish figures over the last kind of 2 to 3 weeks, you can see that consistently the number of introductions from these foreign countries is somewhere between the range of 10 and 16%. And even from Greece, in the last 7 days, I'm aware of 43 different cases across Scotland that have been introduced as a direct result of travel to Greece. So we need to be really careful that what we're not doing is that we're not cumulatively adding to the infectious disease pool within the country, putting more pressure on the system and allowing this virus to establish new chains of transmission that start to spread through our communities. Greece is only one country, but there's many others that we're seeing infections coming back from. That's why these quarantine measures are so critical when you come back from these countries. We know that they're not easy to undertake. We don't ask you lightly to do so, but they're really, really important as part of our broader attempt to try and make sure we contain this virus.
Thanks. Christine Lavelle from The Sun.
Thank you, First Minister. I just wanted to ask about today's NRS report. It's showing nearly 800 excess deaths occurred between April and June for illnesses other than COVID. Could these additional deaths have been avoided? And what preparations are going on to ensure that if there is a second lockdown, NHS services apart from COVID treatment will continue?
I'll hand over to Gregor to comment specifically on excess deaths, but on the NHS remobilisation, we are part of the reason we want to keep COVID under control is to get the NHS back to normal, but the NHS has to make sure it's got the capacity to deal with COVID cases should that prove necessary, and that is part of the balance we're seeking to strike. But what I want to focus on right now is trying to do everything we can to stop a situation that COVID gets out of control again, rather than talking about it as if it's an inevitability. The NHS is doing the planning for that, but all of us should be focused on how do we stop that need for a COVID contingency capacity to ever have to be utilised.
So every year, both within this country and with other countries across the UK and with Europe, we do an analysis of excess deaths to try and better understand the origins of them. And as you say, this year we are seeing a signal which has come through which shows excess deaths go beyond what we would expect directly from COVID-19, but also into some other conditions as well. I'm going to highlight dementia and Alzheimer's disease and diabetes in particular in relation to that. Now, we need to understand fully why that's the case, because are these deaths that may have been contributed to by COVID-19? That's still an analysis which has to be done, or are these for some other reason as well? Over the fullness of time, we'll be much better able to understand and fully develop the story behind why these deaths are apparent in the system. If you look at the cardiovascular deaths, for instance, we know that early on there was an increase in the excess deaths associated with cardiovascular disease, and there were real concerns that people weren't presenting with cardiovascular illness, particularly at times when there was an urgent need for care. We don't know the full reasons why people chose not to present at those times. We need to fully understand that. But the message that we've had all along is that for these urgent conditions, the NHS remains open. So if you, at any point in time, are concerned about symptoms, we would urge you to make sure that you're seeking attention, that you're seeking help, and that you're not just sitting in this, because there's the capacity within the NHS for any of these urgent conditions to make sure that you get the care that you need.
Thanks, Gregor. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. You said today in your opening remarks that you felt that failing to extend the furlough scheme would narrow the options for control of the spread of the virus. Could you explain a bit more exactly what you mean by that? And for example, non-essential offices remain closed at the moment. Would you ideally want to see that continue beyond October, and would the end of furlough potentially limit your options for doing that?
I don't ideally want to see any restrictions continue at all. None of this is ideal, but I think we can see from the figures right now that on top of schools coming back, getting young people back to college, to also have people going back into offices perhaps would destabilise this situation even further. We can't do everything, so we have to make choices. What I meant just to be clearer about that, if you go back, I'll illustrate it with an example. In the situation where we had to impose lockdown restrictions in Aberdeen, which because of the cluster starting in pubs there, we closed hospitality. Now at that point, even businesses, if they had staff furloughed but had brought them out of furlough, they had the ability to put them back into furlough. Now that won't be an option once furlough is ended. So in a situation like Aberdeen, businesses would obviously have a much bigger problem on their hands. So we need to, given that this pandemic is not going to end at the end of October, I really wish it was, but it's not, we can't withdraw support from businesses when they're still dealing with the implications of COVID, and we can and we shouldn't limit our ability to tactically and strategically do what needs to be done to tackle the virus. That to me just makes no sense. Tom Gordon from the Herald.
Hello, First Minister. At the start of the pandemic, you talked about the value of simplicity of messaging. And you said earlier today that the messaging has become more complicated as we have a lot of local variations in the rules that are applying. I just wonder whether you think, as we head into winter, when the risks will increase, whether we might see a return to more simpler national messages and measures on controlling the virus, and whether you think it is more likely than not we will have to go into some form of national lockdown again this winter, akin to the one we saw at the start of the pandemic.
I'm not going to stand here and start to say something is more likely than not. Because that starts to sound inevitable. It starts to sound as if there's nothing we can do to avoid that, and I don't want anybody to get that message. That said, I'm equally not going to stand here and say there's no possibility of that, because that would, not be credible. The message I'm trying to get across on that aspect is, we all have a part to play in trying to avoid getting to that. Government's got a big part to play, principally, not exclusively, through the test and protect system to try to keep this virus suppressed. But all of us have got a part to play in our daily behaviours and trying to stop it spreading in the first place. So I want people to focus on that, and I want government to focus on the things we've got to do, rather than allow ourselves to slip into the mindset of, a second wave and another national lockdown is somehow inevitable. And I suppose that answers the first part of your question. The messages, by necessity, have to flow from the measures. The reason the message was so simple in the early part of the pandemic is, as you alluded to, the measure we were imposing was very hard for people, but in another sense, straightforward. Stay at home. Don't go out, basically. Now, I don't want us to have to go back there. Yes, it would make my communication challenge a lot easier, because it's a straightforward, simple message, but the implications of going back there are enormous. So, much as I like to be able to communicate clearly, I don't want it to be at the price of the country going back into a lockdown. So by necessity, the messages are more nuanced and complex right now. It's one of the reasons why I haven't stopped doing these daily briefings, because it's really important as much as possible to take opportunities just to explain what we're asking people to do and why. One of the things we are thinking about, though, is, without going back to blanket measures that we had at the start of the pandemic, if possible, can we simplify the regulations and the advice that flows from that? And, that's not always easy, because we try to tailor our approach, but we will be trying to make things as simple as possible. But by definition, It's not as straightforward in messaging terms as it was at the start of the pandemic, because what we are asking people to do is not as straightforward, and that just makes it more important, I think, that everybody takes a little bit of time just to familiarise themselves with what the guidance is and try as hard as they can to stick by it as they're going about their daily lives. And last question today, Helen Puttock from The Times.
Hello. On July 23rd, when you announced that people who had been shielding no longer needed to do so, you also mentioned you might create a text messaging alert service for them and possibly for the wider public. So just wondered if you could update us on whether that text messaging forecast service is now in operation, and if not, when it will be.
So a text messaging service is in operation. We use the SMS service to text messages to people in the shielding category. So for example, in the past couple of weeks, people who were in the shielded category in the 5 local authority areas in Glasgow have got a text message to say, you should be extra vigilant. We are continuing to work on how we make that more detailed and more developed so that it is a bit more local than that, and we'll update on that as soon as possible. And my apologies, I am being reminded, and it wasn't deliberate, honestly, that I excluded Tom Martin from the Daily Express.
Hi, thank you, First Minister, and thanks for taking the time to speak to me today. Just can I go back to the opening remarks when you talk about we're at a dangerous place and perhaps this CMO could help with this one. Are we at a stage now where we're starting to see exponential growth again? And what does the modelling tell us about the trends we're seeing in terms of how far away we are from seeing these smaller wildfires spreading out of control?
I will ask the CMO to help me with this. But what I said at the outset to try to give some context was that if you look at our daily case numbers just now, on average this week or the past 7 days, it's been 155. 3 weeks ago, that was 52. So over that 3-week period, you can see that our case numbers have trebled. Our average daily case number has trebled. And if you look at our daily cases on a number of levels, you probably see a doubling maybe every couple of weeks just now. Now, that is what that says, and this is also the situation that has been seen in countries like France and Spain. We have an increase just now, a very definite increase, but it's not at the same rate as it was back in March and April. Back in March and April, and I can't remember right now more specifically, but there were periods as we went into lockdown where the doubling rate was around, maybe it was doubling every 2 to 3 days. So we're not at that rate of growth right now. We're probably more the 2-week doubling. But that can change quickly. It can start to multiply quite quickly, which is why we're, I suppose, sounding the alarm bells at this stage to try and avoid it accelerating more quickly than that.
So are we in exponential growth? No, we're not in that steep part of the curve that you would be familiar with from, as I say, back in March or April. But as the First Minister says, we've got to guard against making sure we don't get back there. The estimates for the R number in Scotland have to come with a health warning just now because of this number of cases that we have. But even they start to show that they may be as high as 1.4 over the last estimates. Now that is nowhere near where we were, as I say, back in the earlier part of the year. But we are seeing nonetheless a rise in cases, and that should give us cause just for thought. And what can we do now to make sure that we slow down that rise and to make sure that we contain that in a way that it doesn't become unconstrained? We're not seeing community spread and transmission to anywhere near like the extent that we saw before. In fact, we don't have that sustained community spread that was very evident in March and April. But anything that we can do at this point in time, putting simple measures to make sure that we don't allow ourselves to get back to that situation, is something that is we've got to concentrate our efforts on just now. So while there's a rise in cases just now, there's still time for us to take action to make sure that we don't allow that to happen. Thanks. And that now, unless I've accidentally excluded anybody else, that does
conclude the questions today. Thanks to all the journalists for joining us. My thanks to Yvonne, who has done the BSL interpretation for us today, and thanks to Gregor for helping me answer the questions. Thanks to you for joining us. I will join you again tomorrow, but from the Scottish Parliament at, I think, 12:20 rather than 12:15 tomorrow. And I'll set out at that stage the conclusions of our 3-weekly review, and then I'll have a session of First Minister's questions after that, and we'll be back here as usual on Friday at 12:15. In the meantime, please help us to keep this situation under control and avoid it deteriorating beyond where it is just now. That means fundamentally for all of us complying with the facts advice, face coverings, avoiding crowded places, cleaning hands and hard surfaces, 2 metres distancing, and self-isolate and book a test if you have symptoms. Please abide by all of that yourselves, but given that those watching, I suspect, are the ones who are most stringently abiding by the advice anyway, please help us by spreading that word and persuading others that may not be watching that they need to tighten up as well just now. So thank you very much, and we'll see you later in the week.